Many parents and professionals in my online courses are waiting for ABA, or they are there because they don't think that ABA that's currently in place is working to its maximum extent. So today, I'm going to give you my thoughts on what to do if you feel that ABA isn't working. Hi, I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, and best-selling author of The Verbal Behavior Approach. I wanted to discuss this important topic from people, parents, and professionals who say either online or they say verbally to a lesser degree that we tried ABA, it didn't work. They believe that ABA is just for little kids with autism, so they have all these misconceptions about ABA. So as a board certified behavior analyst, I want to talk to you today about ABA, what it is, and what to do if it appears that it isn't working. So before I get into ABA as a treatment package for kids with autism, I do want to explain that ABA, which stands for Applied Behavior Analysis, is the science of changing socially significant behavior. It is a science. It's literally like the laws of gravity. If behavior is reinforced, it goes up. If it's not reinforced, it will go down. But it's also, ABA is also a treatment package. So when people say ABA is not working, or we used to do ABA and it wasn't good, they are talking about a treatment package, not the science, because literally the science is never wrong, right? So once I heard a really renowned behavior analyst, Dr. Dave Palmer, speak at an ABA conference, I believe, and he was talking about a feather and how if I had a feather here, I wish I had a feather, but I don't. If I had a feather here and dropped it, it would drop, right? And the laws of gravity would make it drop. But if I had a feather in a closed room with fans going to a certain degree, to basically keep the feather in the air, it would look like we are going against the laws of gravity. The feather wouldn't fall. But that's because of the fans or the external variables that are causing the feather to stay up. So when people say ABA doesn't work, the science is clear. If you reinforce the behavior, it will go up. This has been proven over decades and decades of work. But if you have all these confounding variables, the current treatment package of ABA may not appear to be working. So just like the external variables of the fans keeping the feather floating around, seeming to defy the laws of gravity, confounding variables, the environment, the people, how much stuff is in the room, what people are saying and doing in the presence of problem behavior, all of that can complicate things and make it that it doesn't look like ABA is effective. So in that situation, it's kind of like weight loss programs. Like the laws of science are calories in, exercise, and now hormones and those sorts of things all control weight loss and weight gain. But you can do different treatment packages of weight loss programs. You can try Jenny Craig or Weight Watchers or whatever. Just because you try Weight Watchers and you probably aren't following it to a T, and then you're going to parties and making exceptions, so there's other variables at play. So you decide Weight Watchers is not for me. Usually what people do if they still want to lose weight is they go to another type of weight loss system or treatment package. You don't just then say, well, there's no point in doing anything because weight loss systems in general doesn't work, the science doesn't work. You would then have to, okay, this program didn't work for me. We would need to go to a different weight loss approach, all within the science. So I really encourage people to look at it like it's the science. Science is not wrong. The science will always work. But if you are, whether you're a behavior analyst, speech pathologist, a teacher, or a parent, if someone is doing ABA, applied behavior analysis treatment, and the child is not making progress, the child continues to throw himself on the ground and elope from the building and not make progress and is aggressive, then you have every right to question what's going on, what's the data, what's the treatment package that we have in place, what should we be working on, because no one should stop making progress. Just because you're a teenager with severe autism doesn't mean you're not entitled to continue to make progress. It may not be very fast progress, but we should always be looking for the way to make progress with language and self-care and imitation and vocational skills eventually, and to be looking to decrease problem behavior so that each child can reach their fullest potential. So if you don't think ABA is working currently, if you have a child or clients, there are some things I would recommend that you learn more about. Number one, I would encourage you to learn more about functions of behavior and ABA principles such as reinforcement, extinction, shaping, and chaining, all which are very important to make sure that the treatment package is working. Number two, I would also encourage you to learn as much as possible about verbal behavior principles, including the importance of demand or requesting and how to teach children using errorless teaching procedures and transfer procedures, which I did a video blog on fairly recently. I would also encourage you to learn as much as you can about how to assess and make a plan based on the skills of the child so that you're not using cookie cutter type goals or transferring goals to kids that aren't ready for those goals. The next point is I would encourage you to learn how to collect the right data in as simple a format as possible and help make treatment changes that result in the best progress possible for each child, both at school and at home and in the community. We have to work together. Both parents and professionals can learn all of these skills. And members of my online courses and community are learning together every day, and they're collaborating with each other to make sure that they can apply all of these procedures that make ABA, the science of ABA, work as good as possible for each child. We will always have those compounding variables, those fans in the room making the feather kind of fly when it shouldn't be flying. And we just need to get to the bottom of it. And it's going to be different. It's going to be slightly different for each child. So when people feel that ABA isn't working, they're usually stressed out. So gaining new knowledge and having a community to ask when treatment struggles arise is key. And to find out more about joining my online courses and community, which include type 2 BACB-CEUs for you behavior analysts out there, I would encourage both parents and professionals with toddlers through teens to check out a free workshop at marybarbera.com/workshop. And I hope to see you here next week.